I have a secret for you. Everyone's asking my patient. They all ask, what cream are you using? But the truth is, she's not using a cream. She lost 30 pounds on a GLP-1 and she looks better than ever. And here's her secret. Most patients on a GLP-1 see a healthcare provider and they say, let's wait until you lose weight and address your volume loss in your face then. That's why you see so many people walking around who look gaunt and they've lost all of the youthfulness from their face. They look older. In this patient, we worked proactively and we gave her a biostimulator treatment that encourages her body to create collagen the first month she was on the medication. That was long enough to prove results from the medication, but short enough to be proactive about her volume loss, so she never had the gaunt appearance. And sometimes it takes research time to catch up with clinical medicine. So, despite the fact that we did this over 18 months ago, two studies were published last year corroborating this and explaining why this occurs. Here's why it works. When you wait until you have volume loss and then you feel you can look puffy, but if you address this proactively and stimulate your body to make collagen, that takes anywhere from 4 to 12 weeks. By the time you start to see significant weight loss, your body is rebuilding collagen in the most natural way. There are a few key principles. In the 5 to 10% of weight loss, that's really your prevention window. 10 to 20%, that's your correction window. 20% plus, that's your reconstruction window, and those patients may need to be considered for plastic surgery. This takes an experienced provider who knows what they're doing because this is not a one and done treatment. You likely will need multiple sessions. And that patient I told you about, she comes back in every 12 months for a small investment. The real result, she's the one everyone's talking about because she looks incredible. In the long run, it's worth the investment. Better results and less product needed is always a winner. If you're on GLP-1s, you don't have to choose between your body and your face anymore. And science backs that up. You don't have to wait until you're already hollow. And so when people ask my patient if it was good genes, she just looks at everybody and says, good timing.